afternoon, students. Today we will continue the topic health education. Okay, last class we discussed about the principles of health education. Around 12 health educations. The very important credibility, interest, participation, motivation, comprehension, reinforcement, learning by doing, known to unknown, setting an example, good human relation, feedback, leaders. Okay, so the explanation part we already see. Once again, credibility means the truth of the message, truth of the content of health education that we are going to give. It should be based on scientific basis. Okay, it should not be someone is gossiping or someone is not given any authenticity. That we should not rely. The truth of the message, the trustworthiness of the message who is given, that is very important. Okay, and interest. So in the interest of the group, the interest of the audience that we should consider before going to give health education. Okay, the group is interested, then the process of health education will be easy. Okay, and they will accept it and they will adopt very without any hesitation. Then participation. The audience participation is very important. Okay, without participation of the public, the message or the content they won't accept. Then motivation. Motivation is a learning principle. Okay, motivation through positive reinforcement or positive desire we are giving. Okay, to do or to give or to always go behind them is a type of motivation. Okay, so motivating them to undergo modified behavior. Okay, so then comprehension. Comprehension means the message understandability, the language used for giving health education. So everything should be keep in mind. Then reinforcement, repeatedly doing the health education to the audience is very important. So it will be one of the successful criteria or strategy of successful health education. Then learning by doing. Okay, so doing health education, try to include some demonstration part. Okay, participating an audience in performing the activities. Okay, with the maybe addressing procedure. So participating a family member helping out to assist a nurse in doing the procedure, or some chlorination of well. A healthy member is doing the chlorination of well. So family members can participate and written demonstration can be performed. So all this way learning become easy. The next, known to unknown. This is a simple learning procedure. So it is applicable for health education also. So always identify the background knowledge of the audience, what they know already. Then based on that, build up few more information to the audience. So they will gradually grasp the things. Okay, then setting an example. Always learning is easy when we have an example. Okay, then good human relation. So the communicator and the audience should maintain a good human relation. Then the health education become more effective. Feedback. Health education is, we know that it is a two-way process. Sender or health educator is giving message. That message audience is decoded, and the reply should be sending to the messenger. Okay, so always go to the feedback for audience. Okay, whether it is success or whether it is ineffective, that can be identified by the health educator. Then leaders. So good health education to the community. We always find out the influential community leaders existing in the community. Then health education will be effective. This is just a review of our topic. Then next we see what are the components we normally give in the health education. So we give health education during the home visit or during the practical aspect. human biology, nutrition, hygiene, family healthcare, control of communicable and non-communicable disease, prevention of accidents, use of health services. These are the common area we give health education. Okay, human biology, about the reproductive health system, about the anatomy and physiology of human. We normally give, especially in school, especially while giving about information to the disease, we give some of the biological aspect. So it will be an interested thing to the audience. The nutrition aspect, how to maintain good nutrition status, the caloric value of different nutrients, how to prepare food, all this method, all this aspect we can give. Then hygienic aspect is very important. Hygienic aspect, it include some domestic hygiene keeping in the house and surrounding, how to clean, how to maintain good ventilation in the housing, adequate light and fresh air, proper disposal of waste material, avoidance of pests, insect. These are all we have to maintain in the good housing standards. So this hygiene is very important. Then community hygienic care, surrounding area, like how to maintain proper garbage disposal, adequate sewage and draining. So not only personal hygiene, it include home hygiene, hand hygiene, personal hygiene, menstrual hygiene, community hygiene, all the aspects. It is a vast area. Then coming to the next aspect or next content is family healthcare. Family healthcare, the area, it is again vast. So we know that the reproductive age group, the main the concept is in under the family healthcare is the maternal health, antenatal health, postnatal health, child nutrition, immunization. So all these are the very important area for health education. So next is control of communicable and non-communicable disease. We give health education about communicable disease, how to prevent, what are the different strategies, how it will be effect, what are the treatment methods, what are the dietary methods to contain the disease. Even communicable disease, how to prevent the spreading of communicable disease. These are all, and what are the common signs, warning signs of communicable disease. These are we commonly give in the health education. Then next, another content we normally give in the health education is prevention of accidents. So prevention is accident is very important, especially to the under 5. They are very prone to get accidents in the home. And old age, again another category, they are at the risk of accident, especially falls and all. It is common in old age. So for them, we'll give proper health education. So health education should aim at to prevent common accident which take place in their home, in their workplace, or in the road. Okay, these are especially road traffic rules and all, giving to the school children, giving to the common people, so that we can avoid road traffic accidents. Okay, then use of health services. So many health services are available in near to our community, near to our home. Many of them are not known about which are the services, especially in government hospital. All they prefer go to private hospital, and they are thinking that the services. Okay, so we know that one of the essential, one of the principle of primary healthcare is quality, scientific technology. So scientific technology is used in the primary healthcare that we can utilize in the primary healthcare. So educating people about proper use of health services available to them. Okay, so these are the different contents. Okay, thank you. Next next section I will going to deal about different communication strategies. Okay.